Most people over 60 who get their blood work done and hear everything looks normal never think twice about their B12. I don't blame them for that. Their doctor checked. The number was fine. But here's what most of those doctors haven't had a chance to read yet. A study published just this past February in one of the most respected neurology journals in the world found that the levels we've been calling normal for B12 may be too low to protect the aging brain. Older adults with results in the so-called normal range were showing signs of slower thinking, slower visual processing, and damage to the brain's communication pathways. Their numbers were fine, their brains were not. So today, we are not talking about B12 deficiency the way you've heard it 100 times. We're talking about the 7 symptoms that show up before your numbers even flag. The ones most seniors dismiss as just getting older, and most standard tests completely miss. Stay with me, because knowing these 7 could genuinely change what happens at your next doctor's appointment. Everything in this video is backed by published research, and your doctor will want you to bring it in. I'm not a physician, so take it to them. Okay, let's go. Let's start with something important because it changes everything else in this video. As we get older, our bodies change how they handle vitamin B12. It isn't about eating the wrong foods. Most seniors are eating perfectly reasonable diets. The problem is absorption. After 60, a condition called atrophic gastritis becomes increasingly common. It reduces the stomach acid your body needs to pull B12 out of food. A 2025 study published in the journal Age and Aging, one of the leading publications on aging research, found that atrophic gastritis affects roughly 1 in 4 adults in the general population, and that number climbs to nearly 1 in 2 by age 70. That is not a rare condition. That is a condition that may already be quietly affecting how your body absorbs one of the most important nutrients your brain depends on. On top of that, common medications that millions of seniors take every day, including metformin for diabetes and proton pump inhibitors for acid reflux, are known to further reduce B12 absorption. So this isn't about willpower or diet failure, it's about biology. And the result, according to the NIH, is that as many as 1 in 5 older adults show abnormal B12 biomarkers, even when their standard blood test comes back looking fine. Now, let's get into the 7 symptoms. As you listen, keep a quiet mental note of any you recognize. Symptom 1, the one most people wave away fastest: extreme, unexplained fatigue. Not just a bit tired, the kind of tired where you've had a full night's sleep and still feel like you haven't moved in days. The kind where climbing a flight of stairs feels like it should come with a recovery period. Here's why. Your red blood cells carry oxygen to every part of your body, your muscles, your organs, your brain. B12 is essential to producing those red blood cells. When B12 drops too low, your body starts making red blood cells that are too large and abnormally shaped to do their job properly. Doctors call this megaloblastic anemia. The result is less oxygen reaching your tissues, and that translates directly into fatigue and physical weakness that no amount of sleep seems to fix. According to Cleveland Clinic, Fatigue and weakness are among the earliest and most common symptoms of B12 deficiency. But because tiredness is so easily explained away, poor sleep, stress, just getting older, most people don't connect it to a nutrient deficiency until other symptoms pile up. The question to ask yourself honestly: is this tiredness new? And is it different from how you've always felt? If the answer is yes, it belongs in a conversation with your doctor. Symptom 2. One of the clearest neurological signals B12 deficiency sends, and one of the most misattributed. Numbness, tingling, a pins and needles sensation in the hands, fingers, or feet that seems to come and go, or that worsens at certain times of day, particularly at night. B12 is essential to maintaining the myelin sheath, the protective coating around your nerve fibers. Think of it like the rubber insulation around an electrical wire. When B12 is low, that protective coating starts to break down. Nerve signals stop traveling cleanly. The result is that strange pins and needles feeling, and in more advanced cases, a loss of sensation or a feeling of weakness in the limbs. Cleveland Clinic lists this as one of the primary symptoms of B12 deficiency, and many seniors attribute it to poor circulation or sleeping in an awkward position, never suspecting a vitamin deficiency. If this is happening to you regularly, it's worth more than a shrug. It's worth a blood test. Symptom 3. This is where the February 2025 research becomes critically important. Memory lapses, difficulty finding words, walking into a room and forgetting why, a general haziness to your thinking that you can't quite shake. These are symptoms most seniors put squarely in the just getting older category, and sometimes they are, but sometimes they are not. Researchers at UC San Francisco published a study this February in the Annals of Neurology. They enrolled 231 healthy older adults, average age 71, no dementia, no mild cognitive impairment, all with B12 levels that fell within the accepted normal range on standard lab tests. What they found was measurable signs of slower thinking, delayed visual processing, and damage to the white matter in the brain, the pathways that allow different parts of the brain to communicate with each other. Let that sit for a moment. Normal test results, measurable brain changes. The senior author, Dr. Ari Green of UCSF, specifically called for clinicians to consider B12 supplementation in older patients showing neurological symptoms, even when their standard blood levels look acceptable. A separate comprehensive review published in 2025 confirmed that B12 deficiency remains a modifiable risk factor for neurological and cognitive problems in older adults. Modifiable means addressable, which means this isn't just something to observe, it's something to act on. If the brain fog feels real to you, and you know the difference between a bad day and something that's been quietly shifting, bring this to your doctor. Ask specifically about active B12 levels, not just total serum B12. Those are two different measurements, and the distinction matters. I want to pause here because symptom 3 is the one that carries the most weight in this video. The 2025 UCSF research isn't saying everyone with normal B12 is in danger. It's saying our current testing may be missing people whose brains are already being affected. That is a meaningful difference from what most of us were told even 2 years ago. And it's exactly why these conversations matter. 4 more symptoms. Let's keep going. Symptom 4. One of the most serious on this list because of what it leads to. Difficulty with balance. An unsteady gait. Feeling less sure on your feet than you used to be. Maybe you've noticed you reach for walls more often, or that you're more cautious going downstairs. B12 deficiency can directly affect the spinal cord, specifically a condition called subacute combined degeneration, where the nerve pathways that control coordination and balance begin to deteriorate. According to Cleveland Clinic, impaired balance and coordination are well-documented neurological symptoms of B12 deficiency. Here is why this one matters beyond the symptom itself. Falls are the leading cause of injury in adults over 65. Anything that quietly undermines your balance without announcing itself as a medical problem, including low B12, is a genuine risk to your independence. And because balance changes happen gradually, they're easy to normalize, easy to chalk up to age, until a fall happens. If your balance has changed, if walking feels different than it did 2 or 3 years ago, please do not wait. Mention it at your next appointment, and mention B12 specifically. The first 4 symptoms are physical: your energy, your nerves, your thinking, your steadiness on your feet. The next 3 are different. These are where B12 deficiency starts affecting who you are, not just how you feel. And that distinction matters because they're the ones most likely to be treated as standalone problems, while the underlying cause goes completely unchecked. Symptom 5, the one that gets missed most often because it's almost always treated as something else entirely. Unexplained changes in mood, increased irritability, withdrawal from things you used to enjoy, a low, flat feeling that doesn't respond the way you'd expect to the usual things that lift your spirits. B12 plays a direct role in producing the neurotransmitters that regulate mood, including serotonin and dopamine. When B12 drops, that production is affected. The result can be mood changes that look and feel exactly like clinical depression because neurologically they are creating the same disruptions. WebMD notes that B12 deficiency may lead to depression, confusion, and memory problems. Cleveland Clinic lists mood changes among the neurological symptoms of B12 deficiency. And a 2025 systematic review noted that B12 supplementation has shown benefit in certain depression-related outcomes, particularly in older adults. If someone over 60 is experiencing depression, B12 deficiency is a simple, testable, and potentially reversible contributing factor. A blood test costs very little. And if B12 is part of the picture, treating it could genuinely help, alongside, not instead of, any other treatment their doctor recommends. Symptom 6. Visible but easy to dismiss. A paleness that wasn't there before, or a slightly yellowish tinge to the skin, or the whites of the eyes. Not dramatic, subtle enough that most people assume it's the light, or just how they look now. B12 deficiency leads to the formation of abnormally large, fragile red blood cells that break down more easily than healthy ones. When those cells break down, they release a substance called bilirubin. Elevated bilirubin creates that yellowing effect, the same process behind jaundice, though typically much milder here. The paleness comes from the anemia itself. Fewer healthy red blood cells carrying oxygen means less color in the skin. Healthline and Cleveland Clinic both list pale and yellowish skin among confirmed B12 deficiency symptoms. If you or someone close to you has noticed a change in skin tone that doesn't have another explanation, add it to the list of things worth checking. Symptom 7. This one surprises almost everyone who hears it. A tongue that feels sore, swollen, or unusually smooth. Discomfort eating or a burning sensation. A change in how food tastes. These are all connected to a condition called glossitis, inflammation of the tongue, which is a recognized and documented symptom of B12 deficiency. The tongue is home to taste buds that sit in small bumps called papillae. When B12 drops, those papillae can start to disappear, which is why the tongue sometimes looks unusually smooth and feels inflamed. A clinical study published in 2025 confirmed that glossitis and mucocutaneous signs are significantly more common in patients with severe B12 deficiency. This one tends to come up later in the progression, but it's worth knowing because it's so unexpected. If you've had unexplained soreness in your mouth, or your food hasn't tasted quite right, and you haven't been able to explain it, ask your doctor to check your B12. So those are the 7. And here's what I want you to take away from all of them together. Each one on its own is easy to explain away. Tired? You've been busy. Forgetful? You're getting older. Off balance? You need better shoes. The problem is that B12 deficiency often shows up as a collection of small, quiet things, not one loud alarm, which is exactly why it gets missed, and why knowing the 7 together is more powerful than knowing any one of them alone. So what actually helps? 3 things worth knowing. First, ask your doctor for the right test. A standard B12 blood test measures total serum B12. But the 2025 UCSF research specifically highlighted the difference between total serum B12 and active B12, also called holotranscobalamin. If you have neurological symptoms but a normal standard B12 result, ask about active B12 testing. Not every doctor will offer it automatically, but the research is now clear enough that it's a reasonable question to raise. Second, know your B12-rich foods. The NIH recommends 2.4 micrograms of B12 per day for adults. The best dietary sources are animal-based. Salmon and sardines are among the richest. Eggs, dairy, beef, and fortified breakfast cereals are also reliable sources. These also happen to be exactly the brain foods for memory that sit at the center of the MIND diet, which we covered in our Mediterranean diet guide. B12 and senior health and nutrition are deeply connected, and what you eat every day directly affects your body's supply. Third, understand that supplementation is available. If your doctor confirms low B12, treatment is straightforward. Supplements in tablet form work well for most people. For seniors with severe absorption problems, B12 injections bypass the gut entirely and are highly effective. According to Cleveland Clinic and the NIH, B12 supplements are considered safe. Your body passes any excess through urine. If your doctor recommends them, they're worth taking seriously. Most seniors who have low B12 don't know it, not because they're not paying attention, because the symptoms are quiet, gradual, and easy to file under just getting older. Tired, a little foggy, less steady than before. Mood not quite what it was. And for the people the 2025 UCSF research identified, even the ones whose numbers look completely normal, real neurological changes may already be happening without a single red flag on their blood work. So here is the one thing I want you to do before your next appointment. Not in a panicked way, in a calm, informed way. Pull out your phone right now and type these exact words into your notes. Ask about active B12, holotranscobalamin, not just total serum B12. That one question could open a conversation that changes something real for you. Your doctor will know what it means, and now, so do you. B12 deficiency, when caught, is treatable. The damage it causes, when left unchecked, can in some cases become permanent. The gap between those two outcomes is a single blood test, and you now know which one to ask for. Before you go, I want to hear from you. Of the 7 symptoms we covered today, which one surprised you the most? Or which one have you quietly noticed in yourself or someone you love and never connected to B12? Tell me in the comments below. And tell me your age. Your experience may be exactly the insight the next person watching this video needs to hear. You might be the reason they finally ask their doctor the right question. And one more thing. B12 deficiency doesn't exist in isolation. There is one mineral, magnesium, that most seniors over 70 are already short on without knowing it. And that makes everything we talked about today significantly worse. Same neurological pathways, many of the same symptoms, missed on the same standard blood tests. And the connection between magnesium and B12 is something most doctors never mention in the same appointment. That is the subject of our next video. I will put it right here on the screen when it goes live. If you don't want to miss it, subscribe to Senior Health Mastery now. Every week, we cover the health information your doctor doesn't have time to explain, backed by real published research built specifically for adults over 60 who want to stay strong, sharp, and independent. That is the only thing we do here, and you deserve nothing less. Talk to your doctor, take the test, and take good care of yourself.